This is an epic projection of cervical vertebra. I say so because the cervical vertebra are seen in profile and the spinous process centered and is in the midline of the vertebral body. The spinous process align with the midline and in a straight line and equally spaced. The spinous process of vertebra is demonstrated onto the inferior adjoining of vertebral body. This indicates that the angulation is more than needed. To correct this, decrease the cephalic centroid angulation. The mandibular angle and the masseter tip are equidistant from the cervical vertebra. The pedicle and articular pillar are symmetrical, demonstrated to lateral side of cervical body. The alignment between the S3 tube and IR cannot be identified because the absence of collimation border on both sides. The alignment between the S3 tube and part are incorrect because the center of collimation supposedly at the C4 instead of C5. The alignment between the IR and part cannot be identified because the absence of the collimation of the IR. To correct this, move patient downward and a little bit to the right to center the centering point to the C4. For collimation, the superior border that should be included in the radiograph is the masseter tip and also the occipital bone. At the lateral border, the structure that should be included is the lateral skin margin. For the inferior border, the structure that should be included is the first thoracic vertebra. The kVp used is 65 kVp for penetration and radiographic contrast. This is because the bony cortical outline of the thin structure, which is the superior and inferior end plates, can be visualized, and also the thick structure of the bony cortical outline, which is the spinous process, can be visualized. This indicates that the contrast and penetration is adequate. The MAA used is 16 MAS for detail and density. This is because the thin structure of the bony trabecular pattern, which is the superior and inferior end plates, can be visualized, and also the thick structure of the bony trabecular pattern, which is the spinous process, also can be visualized. This indicates that the density is adequate. Therefore, no change in kVp and MAS. Presence of anatomical marker seen in the radiograph. The placement is correct, which the letter L seen next to the cervical. Use is 18 times 24/7, which is suitable to demonstrate all the structure of interest. There is no artifact seen on the radiograph. Patient's name and ID and date of examination and place of examination is not present on the radiograph. It should be present on the left and bottom side of the cassette.